I hope everyone is enjoying Las Vegas. I'm excited to tell you about a brand new program that Bryte Lyfe is rolling out to all of you to participate in and have access to. It is called True Virtual First Membership. It's a 5-in-1 healthcare solution that really gives a lot of people that are struggling with high cost of healthcare, find ways to affordably manage their options and really have access to quality care. My name is Jason Roll. I've been in the health insurance business for 20 plus years. I've worked for some of the largest national insurance carriers. I also have over 8 years of health share. And today we're going to talk about health share and how a non-insurance product could be a great solution for a lot of people that are either struggling to pay premiums, that have high costs, that don't qualify for subsidies, are trying to find options between jobs so that they have coverage, or just those individuals that say, I don't utilize the healthcare system. I don't like paying a lot of money to have access to it. What solutions do I have? And that's what we're going to talk about today. I live in Broomfield, Colorado, but I do apologize. I was not able to be there because I am in Minnesota today at a hockey tournament with my 10-year-old son. I know it would be great to be in Las Vegas, but the tournament happened to fall on the same weekend, so I apologize for doing a video chat rather than being there in person. Would love to see you all in person and see your excitement about this new opportunity. So in order to start, let's tell a little bit about how health share programs work and how those opportunities to look at alternative healthcare can really help individuals save money. So if you go back a little bit, why are people looking for alternatives? Well, it's if you look at what inflation has done over the last 10 years, and that's the line in blue. You look at what wages have done. They've increased, but not a whole lot, especially with the red line compared to what healthcare costs have been year over year. So that's why a lot of folks are struggling to keep ahead. Because again, if you're only getting a small increase with work, and inflation is up and down, but your healthcare costs continue to rise faster than how much money you're making, that is a problem. And in fact, it's one of the leading causes for bankruptcy in the United States. Over 100 million Americans have some form of medical debt, myself being one of them. I hit my out-of-pocket maximum on my insurance plan that I have because I live in Colorado. I mountain bike, I snowboard, I crash a lot, I have pre-existing conditions. So I'm one of those heavily utilizers of the healthcare system. And every year I constantly have some form of medical debt. But out of all those individuals, 66% of bankruptcies are tied to medical issues, either it's from bills or time out of work, whatever that may be. So even people that have insurance, they still face high deductibles and high out-of-pocket expenses. So let's talk about another option. Let's talk about a health share. It is a non-insurance model for managing your healthcare cost. It's very simplistically put that members contribute a monthly share amount. So you're in a community of other individuals that are all sharing into this community. The funds are then used to pay for members' eligible medical expenses. So when everyone is pooled together, not everyone has medical expenses. But if somebody else has a medical expense, that's where the money is pulled from this pool to pay for other individuals' medical expenses. And generally, it's rooted in a community, whether it's ethics based, whether it's religious based, it's individuals that are coming together that say, I understand how to keep costs low. I understand how to make sure that I'm not taking advantage of the situation and keeping my healthcare costs low. I'm taking care of my body. I'm living a healthy lifestyle. Those are individuals in the same community that have the same beliefs that want to save on their healthcare costs. And typically it's lower than some of the traditional insurance options that are out there. So when you think about, okay, that sounds great. High level, everyone's coming together that is fairly healthy, has the same beliefs, and they're putting their money together. And then if somebody has a need, then it is shared. So the responsibilities of the member is monthly share contributions are going into this pool. And then the member responsibility pays the initial shareable amount, unshareable amount. So that's the amount that you don't that you pay for when you have a medical need. And then you submit medical bills for reimbursement. And then you use providers that have negotiated or discounted rates, or direct primary care doctors, or virtual primary care doctors. We'll get a little bit into that as well, but it's called cash pay. So a lot of providers that have contracts with insurance companies versus if you just walked in and talked to a provider and said, I don't have insurance. What are your cash pay pricing? My wife did this with my son. His throat hurt. He had his ears hurt. And I said, just walk into the doctor and say, we do not have insurance. What is your cash pay? They said, well, let's get him back there and take a look at what's going on, and then we can give you a better estimate. They gave her an estimate up front, but they said, looked in his ears, double ear infection. Sure enough, we're going to need to get some medication. Now, because you're cash pay, you don't need to have a strep test because that's an additional money that we're going to give a medication that's going to knock out the strep and the double ear infection. So there's no need to pay for an extra service. And your cost today is going to be $124. She showed up at the pharmacy and said, forgot the discount card. And they said, okay, this medication, because it's generic in nature, cost $11. So this is what we mean when we talk about providers with negotiated discounts or direct primary care, or you just going in and talking to individual doctors and saying, what is your cash pay? Now, that can be scary for some folks, but a lot of these plans have professionals that will do that on your behalf. Then the other thing too is you adhere to community lifestyle or faith standards. So again, you're joining this community to say, hey, I'm going to take care of myself. I'm not going to do illegal activities like drinking and driving. I'm going to make sure that I live a healthy lifestyle and take care of the community. So what's typically covered? Typically covered doctor's visits. Most doctor's visits in these plans that we're going to talk about today are generally cash pay. And hospitalizations, maternity, surgeries, labs, some of the big ticket items, these are what's really focused on these plans. What is not covered are pre-existing conditions. So that's one of those like, wait a minute, this sounds too good to be true. Well, it's because a lot of folks that are joining this, you can't already be pregnant and say, hey, I want to join this community and I want the community to pay for my pregnancy. Now, down the road, if you have a pregnancy, then those things would be covered. But mental health, some of the high cost prescription medications, elective procedures, substance abuse, those are things that are typically not covered in this. Because again, remember, we're saying, hey, you're a healthier community. You're going to make smart decisions on your health care. So we want to make sure that those things are covered because we're not going to cover other things that would cost the community a lot of money and that you're not being a good steward of the community by taking care of yourself. So here's a simplistic way to think about it. Think about auto insurance. So auto insurance doesn't cover oil changes, doesn't cover tune-ups, doesn't cover tire rotations, doesn't cover your gas. Those are what's considered maintenance. So if you think about what a maintenance plan is, those are things that you just budget for on a daily basis. But if you get in an accident, that's where that auto insurance kicks in. That's where the health share kicks in. As long as it's not pre-existing conditions, as long as you weren't drinking and driving, but you had some health issues that came up, then you can have this health share community help cover those costs. And that's how folks are saving a lot of money. Because again, if you look at some of the other plans that are out there, they're covering everything from A to Z. And that can get very expensive. So when you think about people that might take advantage of this, and this might be a good fit for, I'm healthy. I rarely go to the doctor. I don't want to have high costs for my health care because I rarely go. This could be a great fit. People that that don't qualify for subsidies on the healthcare exchange, but again, they're fairly healthy. This is a great fit. 1099 gig workers, a lot of people in between jobs because you can do this from month to month. You're not locked into long-term contracts with this. So let's get a little bit in the 501 healthcare. We built in some of the maintenance programs in here because we know that, a lot of folks still need to get access to care. They're okay with doing cash pay. Some of them aren't, but they want to make sure that they say, do we have a network? No, there's not a network. It is an open network. You can go to any doctor, cash pay. However, we built in a virtual primary care doctor program in here as well. You also have access to a on-demand doctor 24/7, and you can get some mental health care if you're having a bad day, having some issues, and you need to talk to somebody. You have the ability to talk to virtual doctors. You also have in-person urgent care visits. So you can do three in-person urgent care visits. You call ahead on a concierge line, and they will direct you to a local facility that you can get in-person urgent care. A lot of times they can take care of it over the phone with a virtual doctor and get you the medication you need. You also get an RX membership. So it is over 800 medications at $0. It does not cover every medication. It covers generic. Because remember, if you're on very high expensive medications, you probably have some pre-existing conditions, and this plan might not be the best fit for you. You also get the health share membership. So again, as we mentioned, that you are having a community of people take care of your high cost needs. And then you also get lifestyle and health discounts. So benefits like dental, vision, chiropractic, that you're getting significant discounts because again, cash pay, doctors really give significant discounts if you pay cash for those services. So a little bit about the health share membership. In this specific program, it is a company called Sedera. Sedera's health share membership is a community that brings like-minded, healthy people together that want to participate and share in lower cost health care. Things that are shareable, surgeries, hospital, emergency care, large ticket items, and everything else is designed to be on that cash pay. Or in this program, we also have the virtual care, the RX, some of the things to supplement your out-of-pocket costs. So your simple choice is how much initial unshareable amount do you want to have? So do you want to share $1,000, 2,500, 5,000? So the more you share, the lower the cost is going to be. Just to show you a little bit about what pricing is, you can see here the member responsibility starting at 5,000 as low as under $200 a month. Most individuals look at the $2,500 IUA because you're only going from 198 to 239. So a $40 difference to have a lower initial unshareable amount. So let's go a little bit into what you can sell today. We've made this very, very simple. So again, to recap, a 5-in-1 healthcare solution that is going to save you or your members, individuals that you work with, significant amount of money because again, the cost for all of these services are very, very affordable. And your portal is very easy to use as well. So when you have a portal, this is what it's going to look like. The broker sign up is very simple. So you're going to get an enrollment code to make sure that you can simply go in and sign up for your own account. You'll get a password. You simply put in all your information, access to your back office, and then you have a distribution agreement. You don't need a license. This is only if you have it. You don't need a lot of the information in here. You just put in your basic information. Very easy, simple to get signed up. Then you're going to have your own personalized account. With your own personalized account, it's going to have information about the programs. It's going to go through and it's going to allow you to look up where the diagnostic centers are. Where can I find my chiropractic dental discount providers? Simply type in a zip code and it's going to give you the dentist in your area. If you're saying, well, is it available in every state? It's not. It's going to tell you the states it's available in and the ones that it's not available in. You're going to have access to your brochure and then very simply a quote and enroll. The quote enroll is you just simply put in your name, date of birth. Are you a smoker, non-smoker? So that's one thing that is unique about it as well, is while we don't take pre-existing conditions, we will take smokers. However, there's an additional $75 premium, or I'm sorry, amount that you are sharing to the community because you are living an unhealthy lifestyle. However, you don't have pre-existing conditions. You rarely go to the doctor, but you do smoke, so you can participate. You're going to see here, it's just going to flash update, update, update. Simply hit the update button. And then here's the information of what that's going to be. A one-time enrollment fee of $50, but the two plans of the health share and all the additional lifestyle discounts, RX, in-person urgent care visit, virtual primary care. Simply click continue. Make sure that you have the effective date. So these plans can be effective in 48 hours. So I'm recording this on the 19th. It's available on the 21st. Put the address in, contact, date of birth, credit card, bank draft. You put in their cell phone number or email address. You send it to them. Say, did you receive it? Sign. And then after they've signed, then you hit submit. And it's done. Very easy program, very easy enrollment. Now you have the opportunity to get in front of a lot of people and help them save money on their healthcare. So we are very excited. I'm sure you're going to have some questions. Please make sure you get a hold of even West and forward those on to me. But I am excited to have you part of this program. There's a lot of opportunity and a lot of people that are really looking to save money. And now you have these tools readily at your hand to have a non-insurance product that can help them save money. Thank you very much. Appreciate it. And I'm excited to work with all of you.